If we're looking at coronary artery disease, which is another one of the national health priorities, you can see that a normal artery has the tunica media and the tunica externa, and if we look in a cross section, that it's a nice wide opening. But if a person has a problem with high cholesterol levels, high cholesterolemia, then part of that high cholesterol gets deposited in the tunica of the actual artery, and that deposit takes up space, and that space causes a narrowing of the arteries, and of course that narrowing will decrease the amount of blood, oxygen and nutrients that can reach the heart muscle. So coronary artery disease, also known as CAD, areas of partial or complete blockage can occur. The cardiac muscle, as you know, needs a constant supply of oxygen and nutrients. And when you have a reduction in blood flow, the heart muscle responds by a decrease in its cardiac performance. The reduced circulation supply can result in what is called coronary ischemia. So coronary means relating to the heart, and ischemia means without sufficient blood. And this results from partial or complete blockage of the coronary arteries. The usual cause, as we said, is from atherosclerotic plaque or fatty deposits in the wall of the coronary vessels, and then the plaque or the associated thrombus then narrows the passageway, which reduces blood flow. This can cause irritation to the smooth muscle walls of the vessel, and they can go into spasm, which further decreases the blood flow. And one of the symptoms of coronary artery disease is a symptom called angina or heart pain, angina pectoris. It's in its most common form, it is a temporary ischemia, so temporary lack of blood supply, which develops when the workload of the heart increases. So although the individual may feel comfortable at rest, exertions such as vacuuming, jogging, emotional stress can produce a sensation of pressure and chest constriction, and the pain can radiate from the sternal area to the arms, to the back and to the neck. Here we can see photographs of an angiogram. This is where the person has presented with coronary artery disease, and you can see on the left we've got the normal heart, we've got colour enhanced through an angiography, and we've got normal blood circulation, nice thick coronary arteries supplying blood to all of the surface of the cardiac muscle. And then further on the right, you can see here that this person has got advanced coronary artery disease. You can see that there's very little blood getting through these coronary arteries, and this would be where the person may go on to have a stent put in place, or they may go on and have coronary artery vein graft surgery. So here is an example of an occluded artery, and of course it makes sense that if you've got an area where the blood and oxygen and nutrients can't get past, then the heart muscle that is going to be damaged is going to be distal to that occlusion. So the heart muscle, you can see here we've got a left part of the heart muscle being damaged, and that is the very worst place to have a heart attack or coronary occlusion, because that heart on the left hand side, of course, is the ventricle, the left ventricle, where it needs to be the strongest to be actually pump the oxygenated blood out to the rest of the body.